In 1994, when I came down here, I was really apprehensive. And once I met the people here, I decided I had to come back. In 1995, I had 4 trips here. In 1996, I had 3 trips here. In 1996, one of the groups had a little difficulty with each other, and so I decided to organize a foundation that would be secular and we would not be bound to any particular religious belief. So we are Fundación Manos Juntas and organized with 3 basic missions. One is to make these trips to Nicaragua. 2 is to have a scholarship program here in Nicaragua. And 3 is to have a free clinic in Oklahoma City where we can meet the needs, the healthcare needs of the poor people there. One of the examples was a little girl who was maybe 10 years old, and she was so tall. And she came in, her mother said she's tired all the time, she can't run very far. She gets out of breath. So I listened to her heart, and when I listened to her heart, I could hear this funny murmur. And I listened to it again, and pretty soon I decided without any question that she had a patent ductus arteriosus. That basically is something that's totally curable with surgery. And it's relatively simple surgery. It's a surgery that I could do myself if I had to. And yet it is heart surgery. So it's a very serious thing. We had a nurse who was volunteering with us from the community, and she was helping us with our group. So I called her and I said, we've got to get this kid to the hospital for surgery. And this was on a Thursday or Friday, and the following Wednesday, she had her surgery and was, of course, cured completely. A year later, I'm back in that same community, and this young woman comes up. She's now this tall. She comes up, and when she comes up from me, she lifts her blouse up like this to show me her surgical incision. It was a real thrill to see that success. This is something that I personally feel, I think it's really, really, really ideal for doctors, nurses, PAs, nurse practitioners, everybody to be exposed to. Because in Oklahoma, and I suspect in South Dakota, we write prescriptions, hand them to the patients. The patients leave our office and say, thank you, doctor, and they go and they do not cash that prescription in because it costs too much money. And down here, it's the same kind of thing. So we can talk about helping, but if we don't actually provide the medication, it doesn't happen. And I think this is a very good educational thing for doctors to see as they're in school, because it will allow them to appreciate that their patients are in a different level of financial management. And so we have to modify our treatment programs. If we simply write the prescription for the newest, latest, most expensive medication, you're just mostly whistling in the dark. The patients are not going to take that medication. And so when you see them again and they're not any better, you blame the patients. Well, that's a horrible thing to do. And I think this kind of experience down here gets us away from that kind of thinking. I think we start to appreciate what people have to go through to get health care. Even though it's modest health care, it's very valuable.